Hello, Kin 163 students. This is chapter 5 from Fahi's Fit and Well textbook, and it's about flexibility and back health. So the outline is we're going to discuss first the flexibility concept, the types of flexibility, and what affects flexibility, and the benefits of having flexibility, and how to develop flexibility through the FIT formula. And then the second portion of this lecture will cover the back health. And first we're going to look at the anatomy of the spine, and then we're going to talk about the back pain, how to manage it, how to treat it if we have a back pain. And then we're going to look at some core muscles, the core section of the body, what muscles go into the core, and how we can have a core exercise program. It's a fun chapter to discuss because there's a lot to discuss in terms of how we create flexibility in the body and how we control our body's mobility. So it's a fun chapter. Let's begin with the definition. What is flexibility? It is generally known as the extensibility of the muscles. However, that is not true. That is not the correct definition because it just cancels out so many other factors that go into flexibility or determining flexibility. So if you look at the definition, it is the ability of a joint. So we're focusing on the joints here instead of the muscle only. The ability of a joint to move through its normal, full range of motion. So it's going to be dependent on many other things other than the muscle's extensibility. And we know that ADLs, or activities of daily living, and some recreational activities, your fitness and wellness depend on how flexible your joints are. So see, I'm going to change my expression from being how flexible your muscles are. I'm going to say how flexible your joints are. And I would like to point out the fact that we cannot generalize how flexible our bodies are because it is extremely joint specific, and it is highly adaptable and modifiable. So if you work on improving your flexibility, it's going to improve at that joint. So good flexibility in one joint doesn't necessarily mean good flexibility in another. You can increase your overall flexibility by doing regular stretching exercises for all the major joints. Okay, so what are the types of flexibility? This is important to understand so that we can focus on a specific type at a specific time of our workout routine. Okay, so the first one is static. It's the ability to hold an extended position at one end or point in a joint's range of motion. If your joint's range of motion can go from 1 degree to 100 degrees, then you just extend that joint and then hold that position at one end or point in that range of motion from 1 to 180 degrees. So if you look at this picture, she just reached and maintained a position in that range of motion. And if you can see, it's at the hips and also at the shoulders. So she's working on the shoulder stability as well as spine stability as well as the hip stability, flexibility. And then the second one is dynamic flexibility. It involves movement. So you need to separate those two from one another by just looking at if there is a dynamic action like the one that you see where it says dynamic, or if it's just a snapshot, which is just holding a position. So dynamic involves movement. It is the ability to move the joint through range of motion with little resistance or minimal resistance. It is important for daily activities and sports. For example, pitching a ball, swinging a golf club, jumping over a hurdle like you see on the picture. And then there is passive and active types of flexibility. Actually, these are types of stretching exercises that we can do, but I would like to cover some of them here as well as in the latter slides. So passive, it's outside force or resistance moves joint through the range of motion instead of you applying some force through the muscle action. Okay, so the outside force can be yourself by pulling, like the one that you see in this picture. This can be either active or passive. If he is just leaning forward without contracting any muscles in the leg, but using his hands to pull on the toes to increase the hamstring stretch, which is the back of the thighs, that is yourself as the outside force. Or you can have a partner who is pushing, or you can use gravity, you can use some sort of weight to just take that joint through the range of motion. That's passive, when there is an outside force being applied to help the joint move through range of motion. You can achieve greater range of motion than active with the passive, but there is a greater risk of injury because stretch is not controlled by muscles themselves. With the active, muscle is stretched by contraction of the opposing muscle. So this is important to understand. When you're trying to, when you, for example, sit down to stretch the hamstrings, you are going to contract the quadriceps or the thigh muscles in the front, which is the opposing muscle group of the hamstrings. That's an active stretch, and there is a drawback to it because it may not be able to produce enough stretch to increase flexibility. You're just using the muscles, opposing muscles' ability to contract and stretch the antagonist, like we talked about in the muscle chapter. So you might use active static stretching with occasional passive assist. For example, stretch calves by contracting muscles on top of the shin. Tibialis anterior is the name of the muscle, or pulling the toes toward your head. So you can turn this into an active stretch with passive assist. So you can contract the quadriceps at the same time you can just pull on the toes towards your head to increase the stretch. That would be the most efficient way of doing your stretch, because it combines the advantages of active stretching, which is the safety and relaxation reflex, with greater range of motion from the passive stretch. What are the factors that affect flexibility? So there's going to be three groups, main groups, that we're going to focus on, and those are the factors, and I'm going to cover each and every one of them on the different slides. But as a summary, you have this slide to look at and understand the main factors that affect flexibility. First one is your anatomy. So the joint structure, what sort of joint it is, and what is going on in the joint capsule. We're going to look at it in the next chapter. Then the soft tissues. This used to be called muscle length and elasticity, but I decided to change this because there are other soft tissues like the connective tissue that go into the formula of determining the flexibility at that joint. So the soft tissues that are located in that joint and their length and elasticity, including your muscle fibers and the connective tissue, is the second factor, and the third one is the most fun to learn, in my opinion. I like this one because you can use this to your own advantage, and you might have been doing this without even realizing. So we're going to cover the nervous system, stretch reflex, and inverse stretch reflex. So the first factor, joint structure. Okay, that's what we're going to look at. Joint type. So these are the joint types. I don't want you to memorize any of them, but this is a picture so that you can understand what the type of joint, what we mean by the type of joint. So there's a ball and socket type of joint, hinge joint, as you can see, as your elbow, saddle joint with your fingers, and ellipsoid joint with the wrist, and then pivot joint here through your shoulder, and the plain gliding joint like the clavicle to the scapula. You don't have to know any of this, but if you look at what direction they move, you can understand how they affect the flexibility. For example, hinge joints like the ones in your fingers and knees allow only limited forward and backward movement, as you can see from here. Okay, they lock when they fully extended, so you can't go further than that. Ball and socket joints, however, like the hip, enable the movement in many directions and provide for a greater range of motion. So that's going to determine the flexibility, and it's anatomical and you can't change it. The second one is the joint capsule. The joint capsule is a semi-elastic tissue or structure, primarily connective tissue, that provides strength and stability but limit motion. Okay, and they surround major joints. The bone surfaces within the joint are lined with cartilage. Here you go, this is the bone at the joint. So this is the knee joint that you're looking at right now, and the bone meets the other bone. This is the femur, and this is your I forgot the name of it, a tibia, sorry, femur and tibia, and they meet at the joint, which is your knee joint, and the elastic or the bone surface within the joint is lined with the cartilage and separated by a joint cavity, so they don't glide or run into one another. And that joint cavity contains synovial fluid, which cushions the bones and reduces friction as the joint moves. So synovial fluid is an important terminology that you need to be familiar with, because when you age, that synovial fluid gets reduced by just natural wear and tear. And breakdown in joint cartilage from injury. So if you had injuries, here we go, you see there's going to be some breakdown, or aging, okay, to arthritis, which severely limits joint flexibility. So if you have a damaged cartilage covering your bone at the joint, that's called arthritis, when those bones create friction when they move. And that's at my age, I have some arthritis because of some injuries and also aging in my neck, and it's really painful. So ligaments also, as you can see, we talked about this in the muscle chapter. Ligaments are those connective tissues that connect bone with another bone, both inside and outside the joint capsule. Okay, they can be inside or outside. There's also inside ligaments at the knee. They strengthen and reinforce the joint. So that's also an important factor determining flexibility. And also heredity, which is determining your anatomy also plays a role. And the soft tissues. This is the second main category in the factors, the soft tissues. So those tissues of human body that include skin, fat, linings of internal organs, epithelial cells and blood vessels, connective tissues, tendons, ligaments, muscles, and nerves. So even the skin at that joint will determine your flexibility. And the collagen, okay, well, before we go on to that one, I want to make sure you understand the properties. Muscle tissue can lengthen if regularly stretched. So one of the properties of a muscle tissue is extensibility as well as contractility. So when you stretch the muscles regularly, it's one of the soft tissues in human body, it will get lengthened. Okay, contractile proteins can also stretch in the muscle tissue. The connective tissue that surrounds the muscles, the muscle fibers or bundles or entire muscle, they provide the structure, elasticity, and bulk. So about 30% of muscle weight comes from the connective tissue weight. Most important component of muscle tissue that affects flexibility is the connective tissue. Those connective tissues are categorized into main two types. One is collagen and the other one is elastin. Titin is not mentioned everywhere, but I would like to bring that up too, but mainly collagen and elastin. So those are the connective tissues. Again, those considered to be the soft tissues, one of the soft tissues. Those two are the main ones. So the collagen or white fibers, they provide the structure and support, and the elastin, you can tell by the name of it, those are the yellow fibers and they make the connective tissue flexible. There's also another protein, structural protein in muscles called titin, and it also has elastic properties and contributes to flexibility. When a muscle is stretched, the wave-like elastin fibers straighten. Okay, so these elastin fibers straighten. When the stretch is relieved or relaxed, they rapidly snap back to their resting position. So they're highly flexible. This temporary lengthening is called elastic elongation. This is temporary. Okay, when you do it once or acutely, that's called elastic elongation. And if stretched gently and regularly, connective tissues may lengthen and flexibility may improve. This long-term lengthening is called plastic elongation. At limits of its flexibility, connective tissue can become brittle and may rupture if overstretched. So they're just like the muscle fibers. They're soft tissues, a little bit firmer than the muscle tissue, but still they can become brittle. And the third main category that affects flexibility is the nervous system. Nervous system, let's look at the proprioceptors. Those are the nerves that send information. They're like the messengers about changes in the muscular and skeletal systems to the nervous system, which responds with signals to help control the speed, strength, and coordination of muscle contractions. So they're like sensors, if you will, to detect where your body is in space, okay, or what position and how it moves in space. In other words, stretch receptors in muscle provide feedback on length and speed of the stretch. So that's the stretch reflex. Let's look at the stretch reflex and the stretch receptors. In other words, muscle spindles. So if the muscle is stretched suddenly or too much, there is a too much stretch on the muscle, stretch receptors or muscle spindles, okay, here you go, you see the muscle spindles running parallel to the muscle fiber, so they can sense how fast or how much a muscle is being stretched. They can sense that and signal the spinal cord and cause a reflex muscle contraction, okay? That's why it's called a stretch reflex. So when it's being stretched, the response that is coming from, or a command that is coming from your central nervous system, is to contract the muscle so that it doesn't get ruptured, okay? So they sense the stretch and speed of stretch. The inverse stretch reflex is has something to do with the Golgi tendon organs. They're also sensory nerves or proprioceptors at the muscle tendon junction. So if you can see here, it's not directly in the muscle, but at the muscle tendon junction. They're located here. When there is a strong muscle contraction due to many things or a tension, these Golgi tendon organs sense that because they're located at the tendon and they can sense the tension, and they prevent muscle from developing too much tension. The nerves, the Golgi tendon organ nerves, send the signal to the spinal cord, which then sends the signal back to the muscle, triggering a muscle contraction that resists the change in muscle length. That's the stretch reflex. And the other one, another signal is sent to the opposing muscle, which is the antagonist, causing it to relax and facilitate contraction of the stretched agonist muscle. Okay, so these reflexes, before we move on, I would like to go back to the Golgi tendon organ and repeat what I just said. The response of the muscular system or muscle system is to relax the muscle tissue, because the Golgi tendon organs just sensed that the tension is building up to a point where it's too much. Then they relay that information to the spinal cord, and the spinal cord sent back to a command for the muscle to relax itself. That way that tension is not going to break the muscle tissue. So this is what we use in PNF stretching, or proprioceptive neuromuscular facilitation kind of stretching, or myofascial release with the foam rolling. So that's what you do. You apply an artificial kind of tension with an outside object like a foam roll or a tennis ball, or those balls that you use for massaging your body. It's mainly, this is the mechanism that you're using. You're just stimulating the Golgi tendon organ by creating an artificial tension in the muscle tissue, and that Golgi tendon organ sends that signal to the spinal cord, and the spinal cord decides for that muscle to relax. That's how you relax or massage, quote unquote, your muscles. So what you should be doing when you do the foam rolling is to let that process happen. That's why you should not be going back and forth and rocking side to side. Instead, you find a trigger point, which is a very tender point where there's a lot of tension on that muscle, and you apply the pressure by waiting for like at least 20 seconds so that that process takes place. And we'll look at the PNF stretching in a little bit. So there is an interesting thing that they just came out with research, not just, but they're building this correlation. When you increase muscles' ability to be stronger or muscle strength, it will contribute to increasing flexibility. That's, I think, amazing. Muscle flexibility is linked to strength, and practicing lower body eccentric exercise. And we should remember from the previous chapter what an eccentric exercise is. It's a lengthening contraction, or negatives. That's what they say. And you know, when they do the eccentric exercise in the gym, it increases strength and flexibility and might decrease the risk of lower body muscle injury. So the eccentric exercise, or lengthening contraction, I'm not talking about stretching only or passively stretching a muscle. It's a lengthening contraction, and you happen to use this kind of eccentric exercise with yoga. That's why that creates a lot of DOMS, or delayed onset of muscle soreness, the day after, because it creates this inflammation in the muscles to be stronger, actually. We're going to go with the nervous system still. So the small muscles or movements that only slightly stimulate these receptors cause small reflex action. So proprioceptors in general control speed, strength, and coordination of muscle contraction. And small movements will cause small reflex actions. Rapid, powerful, and sudden changes in muscle length, like bouncing, stimulate receptors and cause powerful reflex muscle contractions while they're being stretched at the same time. So the bouncing action will create both contraction and relaxation, contraction and constantly. And they're kind of risky for general population, but for athletes, they use this for increasing their muscle force generation. So stretches that involve rapid bouncy movements can be dangerous for us and cause injury, because again, each bounce causes a reflex contraction through the stretch reflex we just looked at, or through muscle spindles. So that means if you look at the bigger picture, a muscle might be stretching at the same time it is contracting. So performing a gradual stretch and then holding it allows the proprioceptors to adjust to the new muscle length so that they don't get fired right away, and it reduces the signals sent to the spine, thereby allowing muscles to lengthen and over time improving flexibility. So if you really want to improve flexibility, you have to not stimulate those muscle spindles with bouncy and jerky movements. Okay, so the stretching technique called proprioceptive neuromuscular facilitation, or PNF, okay, takes advantage of nerve activity to improve flexibility. We will look at this stretching, how we're going to do this, but while we're in this chapter or topic, I would like you to understand that this is what is being used in PNF stretching. It takes advantage of nerve activity to improve flexibility. For example, contracting a muscle prior to stretching, it can help allow the muscles to stretch farther. And the advanced strength training technique called plyometrics, that's what we looked at in chapter 4, also takes advantage of the nervous system action in stretching and contracting muscles, which is called stretch shortening cycle, SSC, where you do this eccentric contraction of the muscle and then you just amortization phase. Excuse me, it's an isometric contraction of the same muscle, and then you just create this huge force through a concentric contraction of the same muscle group, like this plyometric push-up. And here you see a PNF stretching. instead of using a partner, you just use an external force to contract the muscle prior to stretching it. Proprioceptors adapt quickly to stretching or lack of stretching. So modifying nervous control through movement and specific exercises is the best way to improve the functional range of motion. Regular stretching trains the proprioceptors, so frequent stretching helps develop flexibility. Stretching before exercising. This is an important thing for you to understand. Yes, we covered this on the first or the second chapter, where we looked at the warm-up and the cool-down, and then kind of touched on it when we covered the muscle strength and endurance chapter, but here you understand why. Stretching or statically stretching before exercising can disturb proprioceptors and interfere with motor control during exercise. That's why we need to save static stretches for after exercising, for the cool down or before the cool down or a part of the cool down. Okay? Repeating stretches allows stretch receptors to reset, like desensitization almost, sensitivity of stretch receptors, slightly less sensitive so muscle can stretch further. Otherwise, if they're too sensitive, they're just going to keep contracting the muscle while you're trying to stretch them. There are some other factors that might affect flexibility. Before we move on to this next slide, they can be temperature. So if the temperature of the environment is warm, the flexibility is going to be higher. And gender also, or sex, women tend to be more flexible than men of same age because of the anatomical variations in joint structure and use. So if you use it, you won't lose it. Okay, but that's a question mark because there's still research being done on if we lose or if there's the reversibility principle applies to flexibility as well. So benefits of flexibility. First of all, the joint health, because like the description implies, flexibility is the ability to move a joint through its range of motion. So the joint health. Flexible muscles, tissues that support a joint are better able to absorb stresses. For example, tight thigh muscles put excessive pressure on kneecap, leading to pain in the knee joint. So joint lubrication enhances, again, is being enhanced through good flexibility, and also having high levels of flexibility will be easier to move body. Aging, unfortunately, decreases natural elasticity of muscles, tendons, and joints, and decreases the level of synovial fluids. So we know that if we already know that, we can keep improving or working on developing flexibility in our body. The second one, preventing low back pain. So poor spinal alignment puts pressure on nerves coming from the spinal cord. Strength and flexibility of core muscles. I repeat, strength and flexibility of core muscles may be preventive. That is not a definite, okay? Yes, everybody says so. You have to increase the core strength. You have to increase your flexibility through the core. Yes, it might prevent low back pain, but that's not still, there is not conclusive evidence regarding the relationship between back pain and the lack of flexibility. In some cases, greater spinal mobility may increase risk of low back problems. So rather than flexibility, mobility may increase risk of low back problems. Also, overstretching may decrease joint stability. But good hip and knee flexibility has been shown to protect spine from excessive motions during activities of daily living. So we know that now knee and hip flexibility will reduce the risk of getting a lower back pain. Poor flexibility does increase risk of injury. So we're looking at the third one. Okay, it does increase the risk of injury. Also, flexibility exercises reduce injury symptoms and help restore normal range of motion as a treatment option. And another benefit, relaxation, definitely reduces mental tension, muscle tension, slows breathing, reduces blood pressure acutely. So if you feel like your blood pressure is going up, you might want to stretch to get the blood pressure down. It temporarily reduces DOMS, but again, the research is not conclusive regarding if it really helps with DOMS. Other benefits like relieving aches and pains from stress or from prolonged sitting. We can relate to this now. So you should be getting up and doing your stretches. And aches and pains and cramps. And of course, it's going to increase your sports performance through better sport techniques. And it's going to provide you with good posture and also balance. Some studies, not all, again, this is not totally conclusive evidence, but some studies suggest flexibility training enhances strength development. But the vice versa, strength enhances flexibility is almost supported by conclusive evidence. Assessing flexibility. So how do we assess or measure to see how flexible our joints are? There is, of course, no test that assesses general flexibility, because flexibility is not general. We have to be specifically measuring the joint's flexibility. There are some tools. There is a standard protocol field test called sit and reach, and it's going to assess the flexibility of the lower back and hamstrings. Goniometry is a technique where you use a goniometer to measure the joint range of motion in degrees. This is mainly used by physical therapists. And of course, you can visually or qualitatively assess the range of motion. Like this, for example, starting with a 0 degree, this is where like it's 30, 45, 60, 75, and 90 degrees. And you can just make an educated guess about what degree he is sitting here. And of course, poor posture, good posture, and you can just look at the posture to again qualitatively assess the flexibility degree at a certain joint. If you see the poor posture on the first picture, for example, the knee joint flexibility is reduced here. Okay, so that's the type of process that you're going through when you do the visual assessments. How do we develop flexibility? So what's the FIT principle or FIT formula? First of all, we need to understand our goal is to optimize joint mobility while maintaining joint stability. So mobility is different than stability. Yes, we would like our joints to be stable to prevent injuries, but we also want some sort of mobility to move through the full range of motion. So it's an optimized balance between those two. So ACSM, again, American College of Sports Medicine, recommends that stretching exercises be performed a minimum of 2 or 3 days a week. Of course, when it comes to flexibility, the more is the better. 3 to 5 days a week or every day, as soon as you wake up or before going to bed, it's going to help improve joint mobility and stability. To prevent injury and improve flexibility, if it is best to stretch when your muscles are warm, either after a warm-up or after cardio, endurance exercise, or weight training. Okay, so we would like to save those stretching exercises. If we're not focusing on stretching only, that's an exception, of course. We would like to save them for the end of the workout. Intensity and time. For each exercise, slowly stretch your muscles. Like we talked about, if you do it fast, then the muscle spindles will be fired and they're going to create the contraction, which this service to your purpose. So slowly stretch to the point of slight tension or mild discomfort, but not to the point of pain. Hold the stretch for 10 to 30 seconds. The feeling of slight tension should subside slowly because your body is getting used to it and it's not a pain anymore. And do 2 to 4 reps of each stretch for a total of 60 seconds per stretch. A complete flexibility workout, if you're just focusing on flexibility, usually takes 10 to 30 minutes. And make sure to include all the joints in the body. Pre-exercise stretching may decrease strength and performance in explosive actions. So if you're an athlete involved in an explosive sport, then it is best not to stretch prior to your event because it's going to decrease the strength and performance for 15 to 30 minutes after stretching. It is likely to see improvements in 2 to 3 weeks if you are consistent, of course, like any other thing. And 2+ months, it is likely to see 10 to 20% improvement in range of motion of many joints. Okay, here we go. The types of stretching. There is a static stretching. That is the most recommended one because it's safe and effective. Should be held for more than 30 seconds. And after 30 seconds, if you keep holding it after 30 seconds, there is little additional benefit to it. But if you keep or hold the position less than 10 seconds, there is little benefit as well. Slow stretch prompts less reaction from stretch receptors, so we should be going with the slow stretching. Ballistic muscles stretched suddenly in bouncing movements. You can see or watch a video on how it is performed, but it triggers stretch reflex and may be counterproductive. Also, increased activity of stretch receptors can continue for a period of time, for example, during physical activities. The risk of injury is questionable, depends on the person. Dynamic or functional stretching, it's just moving the joints through full range of motion. It needs to be controlled, fluid, not jerky, like a lunge walk. That is a great dynamic stretching exercise before a workout, for example. It's functional, it's going to help with the workout, and it's going to get your joint ready and fluid for the workout. PNF, proprioceptive neuromuscular facilitation, uses the reflexes initiated by muscle and joint receptors to enhance training effects. So you can do contract, relax rounds or contract, relax, contract rounds. So when you do the contract, relax, you just do a 3 to 6 seconds of an isometric contraction of the same muscle that you're trying to stretch. So you just tighten the muscle in place, okay? But you should not be doing this with maximal power, just 20 to 75, like half of what you got, okay? And brief relaxation, and then 10 to 30 second stretch. So that's contract, relax. You can do this with a partner, or you can use an outside force, your own hand, or gravity. And contract, relax, and contract cycle goes 3 to 6 seconds of isometric, brief relaxation, contracting opposing muscle antagonist. If you're stretching hamstrings, for example, with the second contract, okay, step, you're contracting the antagonist, and then you just do 10 to 30 second stretch of agonist muscle, which would be the hamstrings. We looked at the passive and active. Passive is outside external force. By a partner, gravity, weight yourself. You just force the joint to go to the range of motion. It's not the same thing as this one, okay? With this one, you contract the muscle, but here, passively, you just put your leg up on a wall or pull your leg into your chest when you're trying to do a laying down, leg up in the air, trying to stretch the hamstring. So that's the passive. Active, you're contracting the opposing muscle. So when you're trying to stretch your hamstrings, you're contracting the quadriceps to help with the level of range that you can get from that movement. But all in all, safest is, or recommended is, active static stretching with occasional passive assist, like we talked about. So this is an example of a flexibility program with the FIT formula underneath coming from the text. The text also includes the stretches to avoid. It depends on the individual. That's why I'm not going to cover that, because some individuals, it might not be as dangerous for other individuals. So you can just take a look at them because they are believed to put high stresses on joints. Lower back health is the second half of this course or chapter. So let's look at the spinal column first. So the spinal column, the functions of the spinal column, but first understand that the spinal cord, which is part of your central nervous system, in addition to your brain, is housed in the spinal cord. So, spinal column. That's the main function of spinal column. So, surrounds and protects spinal cord. It provides structural support for body, especially thorax, which is the middle portion of your body, and then supports much of your body weight and transmits it to lower body. Attachment site for muscles, tendons, and ligaments. It's like your core, the center where all the muscles attach, and allow movement of neck and back in all directions. It is made up of vertebrae. Cervical means your neck. There is 7, and then thoracic is the trunk. There's going to be 12. Lumbar is the lower back region. Here you go. And there are 5 vertebrae here. And finally, the pelvic region is a fused together one piece, sacrum and coccyx. And you can, if you were to separate those vertebrae, you're going to find 9 of them. But main thing that I want you to understand is the intervertebral disc you see in gray in the picture. These are elastic discs, and they're shock absorbers, and they help maintain spaces between the vertebrae where spinal nerve roots are located. You don't want to pinch those nerve roots, and if you do, then you will feel the pain. That's why you want to keep that space between the vertebrae through the intervertebral discs. There are 4 curves: cervical, thoracic, lumbar, and sacral. that they help bring body weight supported by spine in line with axis of body. So the way it was created should be kept the same, but we all know that overuse or bad posture will change these curves so that the spine is not, with your body weight, is not supported anymore. That's where the pain begins. And here we go, low back pain. That's what we're going to discuss. More than 85% of Americans have back pain at some time. Okay. This is the second most common complaint after headaches, and estimated as much as 50 billion per year due to medical and legal costs, disability, and lost productivity. So it is an important ailment to deal with as a government or as a country, as well as an individual. The pain is felt mainly in the lumbar area because it, like here, the L1, L2, L3, L4, and L5 vertebrae, and it's called the lumbar region. And because it bears majority of the body weight, spine is well equipped to bear weight and force of body movements along long axis. It is less capable of bearing loads at an angle to its long axis or when trunk is flexed or bent. So when you reach forward or bend your spine, it's not as capable of bearing loads. That's why you have to keep that spine erect like this and not have that hunched back position, because now if you have a hunched back position with a flexed spine, that's not going to be able to support your weight, and then the intervertebral discs get affected. So what are the causes of lower back pain? Poor muscle endurance and strength in the core muscles, and poor posture, like we talked about, because poor posture will change this curvature. Their occupational, this is interesting, but I would like you to make an educated guess about what kind of occupations would have, or you would see low back pain the most. Those are generally construction work, like physical work, as well as desk jobs. And then excess body weight. This is another cause, and it is important because your spine is carrying that body weight and trying to support it. If you lessen it, it's going to be easier on the spine. Physical stress can cause discs to break down. Physical meaning like a car accident, or more commonly long-term effects of weak back pain, lose some ability to absorb shock. So if you had a sudden traumatic injury, whiplash, or you fell down on your head, and those are gonna again make the discs to break down, the intervertebral discs. Other things, psychological stress. This is interesting, but yes, it is true. Depression and psychological stress creates spasms around those muscles and increase the tension, and that tension will change the discs maybe. So that's also another factor. Also age, being over 34 years of age. Also degenerative diseases like arthritis, osteoporosis, sedentary lifestyle, not moving, that's considered a risk factor. Not moving enough, smoking, because it appears to increase degenerative diseases or changes in the spine. So like we said hard physical work, lifting with with bending the spine instead of bending the knees, that's very common. And the force positions and some vibrations like truck drivers, and concentration while sitting like computer programmers. How do we prevent it? So if we know the causes, like the ones that are shown here, we can assess the risk factors and then try to prevent them from coming to hurt you. Treating back pain is still being investigated. Yes, the medicine is every day trying to find something new. But I would like you to understand movement helps lubricate spinal discs and increases muscle fitness. For example, your legs and trunk. So movement is important. Maintaining a healthy weight is important. Stopping smoking and reducing stress is important. All of them are important. Avoid sitting, standing, working in the same position for too long. And if you have to do it, like the position that we're in right now, you have to support the spine with some, props and pillows or however you are comfortable. But mainly your spine needs that support. Use lumbar support when driving, especially for long distances or when sitting, like now we're sitting too much. And make sure to warm up thoroughly before exercising, and then progress gradually when attempting to improve strength or fitness. We talked about that in the previous chapters. Let's say we have low back pain. Let's look at how to manage. So acutely, let's say we just had an injury or we somehow hurt ourselves today and we have a low back pain. That's the sudden back pain, and it usually involves tissue injury. First, we need to apply cold and then heat, and this is gonna work with reducing the inflammation. Mainly, we apply rice, rest, ice, compression, and elevation, again for the hopes of reducing inflammation. Bed rest immediately following the onset of pain may help. Again, it's not certainly. So it depends on the individual and the case. And see a physician definitely if acute pain doesn't resolve within a short time. Back pain that lasts more than 3 months is considered chronic, and let's look at how to manage chronic pain or chronic lower back pain. So there are different treatment strategies, and again, they're individual. Medications. For example, some people experience as stabbing or shooting pain. Others experience it as a steady ache accompanied by stiffness. So different people will benefit from different treatment strategies, like the painkillers or muscle relaxers. Exercise, I think, is going to benefit everyone, again depending on how critical the spine is in. So you might be kept away from exercise for a little bit, but this, we're talking about chronic, so it's going to live with you, and you have to find a way to move and exercise the soft tissues to start the healing process. Physical therapy, massage, yoga, chiropractic care, these are all, again, individual choices. So is acupuncture. PENS is percutaneous electrical nerve stimulation. TENS machines are used for this. Your doctor might prescribe you with that, or education and advice about posture, exercise, and of course body mechanics, and finally surgery. So exercises for prevention and management of low back pain. First, we need to perform low back exercises 3 days a week. we have to make our lower back stronger. Emphasize muscular endurance. With that FIT formula, you need to select the acute variables of exercise, like the intensity or reps and sets, based on muscular endurance. Don't do full range of motion spine exercises early in the morning because the muscles are not warm enough. Engage, or the joints are not lubricated enough or fluid enough. Engage in regular endurance exercise such as swimming, running. Of course, running depends on how serious your situation is, but swimming is a good way, or any walking, any endurance exercise we talked about. Be patient and stick with your program. If you are given with some exercises by your physical therapist, you have to be patient and consistent with them. You have to stick with the program, and you have to be doing them every single day. Forget the adage, no pain, no gain. It doesn't work here. If you have pain, you gotta stop. And emphasize spine stabilization, isometrics, and mobilization exercise. We talked about this in the muscle strength and endurance chapter. So the stabilization exercises such as plank, as you see in this picture, are isometrics, and they work well with rehabbing the muscles surrounding your core. Which brings me to core muscles fitness. So the core muscles, as you see in red in this picture, are the trunk muscles. They're not just your abdominal superficial muscles, okay? So they're trunk muscles extending from the hips to the upper back. So it includes the front and the back. I'll show you in a slide on the slide in a picture soon. So they attach two ribs up here, hips down here, spine in the back, and other bones in the trunk of the body. Trunk, the core. They stabilizes the spine and also help transfer force between the upper and lower body. So they're not just there to stabilize. So from the front view, you see the deep muscles on this left side and then the superficial muscles on the right. And mainly it is known, the core is known as the abdominal muscles, but it's not only abdominal muscles. Yes, the superficial rectus abdominis, or in other words, six-pack, external obliques, but in the deep version, you see the internal obliques, transversus abdominis, and the hip muscles, rectus femoris, iliopsoas, tensor fascia lata. So those are all the hip muscles, as you can see, even going down the leg, and then the deep hip muscles like all the adductors, and then arbitrator internus, piriformis. And then if you look at from the back view, superficial muscles, of course, as we know, the lats, latissimus dorsi, and erector spinae, and all the other spinal muscles on the surface. And then deep down there are other spinal muscles like QL, paraspinals, rotatoris. These are important to improve stabilization, okay, and then the hip muscles, again, glutes, and then deep hip muscles, the medius and minimus. Majorly people are focusing on only the maximus, gluteus maximus, but also deep down there, these deep muscles stabilizes your spine. So what should we do? During any dynamic movement, core muscles work together. As you see in this little video here, or graphics, you see that he's not laying down, as opposed to what is known or what is believed out there to work the core muscles. Even though he's not laying down on his back or on his stomach, he's doing a lunge and an overhead press, and twisting the spine. That way he's using the core muscles to work together. So dynamic movement will always use the core muscles, just like during the day when you're walking. That's a dynamic movement, and your core has to support you. Some of the core muscles shorten to cause the movement. So in green, I would like you to understand the functions of the core. So they shorten to cause movement, mainly the superficial ones like the abdomen, the rectus abdominis, or the six-pack, or erector spinae in the back. And others contract and hold to provide stability, like the deep ones, and lengthen to break movement. So this is eccentric, and this is isometric, and this is concentric movement or action of the muscles. So that's what they're saying here. Or they send signals to the brain about the movements and positions of the muscles and bones, like we saw in the proprioceptors. So best exercises for lower back health are whole body exercises that force core muscles to stabilize the spine, deep core muscles, in many different directions, such as whole body exercises, for example, squats and planks, as you see in those pictures, and moving planks from hands to elbows is even better. As a summary, it's a long chapter because there's a lot of anatomy and factors going on to affect the level of flexibility we have. So I would like you to understand that portion, flexibility, which is a health-related fitness component, and what are those factors that affect flexibility, so we can benefit from them or modify them to be beneficial for us. And then the second portion of the class, we looked at the back health, anatomical factors, and the role of physical activity and the core. This is an important chapter for you to understand, to improve posture, especially during these times where we have to sit too long. And you should look for ways to improve your joint flexibility and mobility and core endurance, improving your core endurance. I hope you enjoyed it as much as I do. And if you have any questions, we will take care of them in our next meeting. Thank you for listening. See you in the next chapter.